Welcome to the Kidney Week 2020 Reimagined podcasts, where ASN President Anupam Agarwal will be hosting discussions about various topics in nephrology. ASN thanks Akebia Therapeutics for support of this podcast.
Hello, everyone. I'm Anupam Agarwal, President of the American Society of Nephrology, and delighted to have two guests for this podcast, number 3, during ASN Kidney Week. I have Dr. Masaomi Nangaku, as well as Dr. Cynthia Delgado. I would like them to introduce themselves. Dr. Nangaku?
Hello, this is Masaomi Nangaku from the University of Tokyo. I'm a Vice Dean of the University of Tokyo and the current President of the Asian Pacific Society of Nephrology. I'm very happy to join this podcast.
Hello, everyone. My name is Cynthia Delgado. I'm an associate professor with the San Francisco VA Medical Center and UCSF. I am currently the chair of the Diversity and Inclusion Committee for ASN and the co-chair of the NKF ASN Task Force on Reassessing Race and the Assessment of Kidney Function.
Thank you both for joining us. It's been a busy last couple of days, so we appreciate you taking the time to do this. So let me begin by asking you, Dr. Delgado, can you tell us what do you believe is the biggest social issue facing nephrology today?
Well, that's a very good question. And I think, over the last few months, our efforts have really been highlighted with all of the social unrest that the United States has experienced over these last, 8 months. I have had these conversations with our committee. Some of the bigger issues is really aligning ourselves with the issues that our patient populations serve. We do have a disproportionate number of individuals who are underrepresented, who are at highest risk for, end-stage kidney disease and chronic kidney disease issues. And, their social determinants of health are really key to, being able to address their healthcare with living with kidney disease in a more cohesive, healthy life experience. Moreover, I think that, the society itself has been moving mountains in the last few months with identifying ways in which we could address diversity within our own membership and our leadership, which I think is also one of the key pillars of addressing some of the issues that we have been facing in the last few years.
It's great. Thank you, and really appreciate your leadership of not only the Diversity and Inclusion Committee, but also your leadership in co-chairing the EGFR task force. That's a joint task force between NKF and ASN. So thank you. Dr. Nangaku, can you tell us from your perspective in Asia or in Japan, what is the biggest social issue you think is facing our specialty today?
Thank you, Anupam. That's a very important question. The social issues differ so much among the countries in the Asian Pacific region because we have many high-income advanced countries and we also have many middle and low-income countries. The situations are so diverse. Talking about Japan, I think one of the important issues is that our society is getting pressed and the government is not willing to provide enough budgets to researches, especially basic researches. I think basic researches are very important for the future of nephrology and other expertise. I think that's an important issue which we are facing right now.
So along those lines, Dr. Nangaku, do you believe that because of the difference maybe in income level and so on, is that a big issue in terms of a social determinant of health in Japan?
It was not a big problem before, but I think the COVID-19 situation expanded the difference of the situations among people who are rich and who are poor, even in Japan. I think the situation is getting more serious.
And Dr. Delgado, can you highlight some of the key social determinants of health that we face in the U.S. at least, and how they, they're clearly different from what the Asia Pacific region or Japan in particular have. Could you highlight a few of those that you think are important?
Sure. In listening, I was just thinking to myself, there actually may be more commonalities than we think with other issues related in other countries with social determinants of health. But some of the key things within our own sphere in the United States with social determinants of health do include, issues related to health insurance access, the income, unemployment, food security and housing stability. Just yesterday there was a session that highlighted some of the issues related to housing stability, specifically within the setting of COVID-19, and how there's more than 5 or 6 states who had a greater than 40% increased reporting of individuals who had housing security issues. And I think that those things have really been highlighted in the setting of COVID-19. But I do agree that disparities based on income and potentially some of the ongoing issues related to institutional differences by race might also be playing a key role in that, particularly with achieving an income level that would allow an individual to participate in their own health care with security in their home and their ability to provide for their own families and themselves.
No, absolutely. I think, living in the southeastern United States myself, in Alabama, I witnessed it firsthand, Cynthia, where we see disproportionate amount of minority patients, who flood the emergency rooms and are really sick. And when we look at the mortality from COVID and complications from COVID, it's so much higher in our minority populations in the Southeast. And you've seen papers in the New England Journal of Medicine and elsewhere on highlighting that in, Louisiana, Mississippi, Alabama, Georgia, and so on, that clearly whether it's due to access of care or existing comorbidities or, other issues, the complications from COVID is so much higher. More importantly, mortality is so much higher in African Americans and other, populations for sure. So, and I'm sure you probably witnessed that in San Francisco.
Well, when you think about the patient population, it's very easy for all of us to say shelter in place and take all the precautionary measures, which are definitely very important. But the individual in question, if they have multiple part-time jobs where they're in working environments where they're constantly exposed to other individuals and they have to work to be able to keep the roofs over their heads, it does become quite a challenge to be able to provide care and to be able to access care for yourself or anybody else if you're busy trying to make sure that you're struggling. Really, if you're really struggling socially with some of the basic things that, most Americans already have in place, and it's really struck me, particularly here in San Francisco, with the number of individuals who have lost their housing or have, had to turn towards using more public services or even in places like, I think I read earlier today in Michigan, where families and groups of communities are banding together to hand out boxes of food, and there's lines, for hours for people waiting to get, what might be just a few hundred boxes of food and not enough resources for everyone. And so that's where the interplay between these social determinants of health and ongoing issues related to COVID-19 really do highlight the problems in the United States.
No, most certainly, Cynthia. You said it really well. Dr. Nangaku, can you tell me, expand a little bit more on how 2020, particularly with the COVID-19 pandemic, how has it exposed all these social issues in nephrology as far as how you see it in Japan or other parts of Asia in your role as, president of the Asia Pacific Congress of Nephrology?
Thank you, Anupam. I think the big issues are disruptions of regular health care, which required us to make huge efforts against COVID-19, in addition to our regulatory health care. In Japan, the ethnicity is very homogeneous. Most of the Japanese are Asians, but the medical care can differ depending on where they live. In big cities, we have many big hospitals and good healthcare, while if one lives in the urban rural area, the healthcare may not be so good. But for some reason, the COVID-19 is controlled in a good manner, which is a huge mystery for us, because we all know that our government did everything wrong. So we do not know if this is something genetic or habitual or something else. We do not know shake hands. We do not hug, or we put off our shoes when we go into houses. But we really do not know why the situation is not so bad, because we think our government did everything wrong.
Interesting. That's a really interesting thought. Somebody would have, predicted that Japan would have a really bad outcome, but look at the number of cases compared to at least the United States and parts of Europe and India, and it is, exceedingly worse than in Japan. So that's an interesting thought. And has the weather change affected the number of cases at all in Japan, Masaomi? For example, now with the colder climate versus summer, how has that been working for the case load in Japan now?
I think in Tokyo, we have every 200 new cases every day. And I think in total so far, we had, I believe, 100,000 patients, all in Japan.
Yes, that's really impressive how you have controlled it. And I was seeing data from yesterday. Yesterday alone, we had more than 81,000 cases in the US. That's almost close to the total number of cases in China for the whole pandemic. And that's just really unfortunate what we are seeing in the US. And its prediction are it's only going to get worse now with colder weather. And how is it affecting the California area, Cynthia?
Well, I think, initially the biggest hotspot in California was actually in Los Angeles and in the areas of Southern California, and with some pockets here and there in the Bay Area. But I do think that probably the colder climate may not be as severe in California when compared to the Northeast. However, the risk of, co-managing COVID in the setting of the flu season is a real serious concern. And particularly keeping that in mind with, continuing to provide care for other healthcare conditions is a very serious thing. And I do think it does portend for, regardless of whether you live in a climate that's warmer or colder, from the Northeast compared to the Southwest, I do think that those issues are very serious and things that we should be bracing ourselves for.
Well, let's get to another question. So what role do you think the nephrology community, both nationally as well as internationally, can play to address these social issues of racism or social determinants of health? What are your thoughts for how we can address these issues? Cynthia, maybe you can go first.
So I'm actually quite proud that, recently we have started taking a stand on a national level along with our other society colleagues with standing up against markers of institutional racism and highlighting how important it is to have a diverse workforce and how the diversity in the workforce really does enhance our continued care of patients and our mutual appreciation for science. And so I do think that, working across the aisle, if you will, with our other specialty care colleagues, as well as with our governmental agencies to sort of highlight this and really work towards not only addressing these issues on a larger scale, but even at the patient level is really important. And some of the things that have been highlighted, particularly at the patient level, is thinking about, not just, I think sometimes often we think about, management of hypertension, value status, anemia management and when the patient is right in front of us, but maybe taking a step back and asking questions such as, are you working? Do you have any issues with work? Is there anything else that you need help with? Are there things that you think may be preventing you from following through or being able to take care of yourself with regards to your kidney disease? Maybe things that we should start integrating into our general practice. And then on a global scale, on a larger scale, I do think that there are things that we can learn from other countries. And there are other places that have, really thought about this a little bit more and have integrated things such as India. And I do think that the national and international collaboration that we have when we come together through ASN can actually be utilized to sort of target these sorts of issues, not just within the United States, but internationally.
Masaomi, how do you think we can address it, more on the international front, issues of racism and social determinants of health?
Thank you, Anupam. We are in the extraordinary times which we have never faced because of the COVID-19. And it is really important to keep this international communication. As Dr. Delgado pointed out, we have a lot to learn from other countries, both about racism and both about the COVID-19. When this disease broke out, at first I contacted my Chinese friends for lessons, and then I contacted my friends in Italy and in New York to get the important lessons to get prepared for COVID-19. Unfortunately, we have lost a lot of chances of international communications, and this Kidney Week is really important to keep the international communications. We have to keep in touch.
But do you all have any other closing comments that you all would like to make, Cynthia or Masaomi?
Well, I do want to say I have been getting up at 6 a.m. my time to listen to all of the live sessions and ask questions. And I've been reading through some of the questions and commentaries. And I do want to say that I think this issue of social inequity has really, as far as I can see, has really influenced the way even our viewers for our virtual Kidney Week has changed things. Every single session I've attended has had a question about what are you actually measuring with, say, race? Like, what do you think race represents in your analysis? Or, I've seen people, talking about advocating for, including our more addressing more health equity and looking at other social determinants of health in particular, as it disproportionately leads to development of kidney diseases. And I do think that our community and our effort as a group to band together and to really push ourselves and others towards having an environment with a greater appreciation for having more equity within our patient care, I think is really something to be proud of and something to look forward to in 2020 and 2021 coming.
Great. Thank you. Masaomi?
Yes, talking about the Kidney Week, I found the speakers and the chairs are really diverse, both in terms of gender, career path, and regions. So you paid a lot of attention, and you made this first virtual Kidney Week very successful. You did a great job, and this will be the role model for the future meetings. But I also think in-person interactions are very important. So if COVID-19 gets controlled, I really want to come back to US and see you face to face.
We really want to see you too.
Yeah, we would love for that to happen, and we are hoping we'll have a vaccine soon, and we should meet in San Diego next year, November 2021. So that'll be. We are all hoping for that.
ASN thanks Akebia Therapeutics for support of this podcast. The content of this podcast is for informational purposes only and does not constitute medical advice in any way. Thank you for listening to the Kidney Week 2020 Reimagined podcasts.